Alright, so for the next muscle we should be looking at its basic anatomy, because later on we'll be talking about pathologies of the hand, and we might be calling it, is the extensor carpi radialis longus. Alright, extensor carpi radialis longus. So it's usually spelled as what? ECRL. So you could look at this, the muscle and the tendon. So it's a superficial forearm muscle. It plays a key role in wrist extension and radial deviation. Alright, so it will help you lift your hand and move it towards the thumb side. So it's part of the posterior compartment and belongs to the radial group of wrist extensors, along with the extensor carpi radialis brevis, and also the brachioradialis. This is the extensor carpi radialis brevis. This is brachioradialis on the top there. So what we got is, for the anatomical snapshot, origin from the lateral supracondylar ridge of the humerus. Insertion is the posterior base of the second metacarpal bone. Alright. Then innervation is the radial nerve, blood supply is radial artery, and also the radial recurrent artery. So functions: extend the wrist, that's like dorsiflexion. Abduct the hand, that's radial deviation. Assist in elbow flexion, that one is a minor role. Also stabilizes the wrist when you're trying to grab things, you understand, especially when the wrist is extended. Alright, so clinical relevance is, you can have a lateral epicondylitis. This is where the muscle originates from, so you can have an inflammation there. So it's often involved due to maybe repetitive wrist extension issues. You can also have the intersection syndrome. Alright, this one is inflammation, where the tendons cross each other and all of that. Alright. Okay, so you can also have the radial nerve injury. This one impair the wrist extension, reduce the grip strength. Alright, so assessment and palpations is resisted wrist extension, abduction enhances it. Alright, you can also palpate it in anatomical snub box and also the lateral forearm. Okay, so this is for the extensor carpi radialis longus.